Aren't those stories amazing? We love to watch those videos, and we'll be able to share those broadly after this event. You notice I had to bring my notebook up here today because there was so much activity on Whova yesterday. I wanted to make sure we captured some of your questions, comments, and again, any questions you ask that we don't get to answer from this stage, we're collecting those, and we'll make sure that you all get those at the end of the event. A few things I wanted to highlight. There were several questions in the Whova app about how do we implement this at our facility, or we have some devices and aren't really sure how to use them, or we need more ideas about we have them, we're using them, are there other places we can use them, and things like that. That is why the VHA XR network exists. So if you have a va.gov email address, we will post that link in the chat for you. And you can join. If you signed up on Whova from a personal email address, you won't be able to access it from that link, but you can certainly also reach out to VA Immersive at va.gov. We'll get that link over to you. But there are lots of things there, including some of the resources you all saw yesterday and asked about, the intro guide, the implementation guide, and the experience guides to help you learn how to plan events. The intro guide and the implementation guide are actually, we also have public versions available on our website. So if you go to innovation.va.gov and navigate to the Immersive page, you can download those public versions. We do have some internal private versions with additional information that are things that are sensitive, internal links, or pricing and information. So things like that. There's that ongoing poll about what should we as VA Immersive focus on for the next year. 56 replies when I looked late last night, so thank you for all that input. Also, just so you know, at least the way I understand it, the team can help me understand if this is wrong. We are the only ones who can see what you put. So whatever you place in that is only seen by the administrators and the speakers. So don't be afraid to speak the truth and tell us what you really want us to focus on. And we are also reviewing that with executive leadership. So tomorrow our goal is to make some strong statements about where we plan to go over the next year, again, based on your feedback. We also want to make sure everything that's grown up in the VHA XR network as a resource to our staff and more broadly to people outside of the VA has been just based on what we've heard from you that you need. So please don't hesitate to give us feedback. We may think that an intro guide on paper is helpful, and you may think, I'm never going to read that piece of paper. So it would be helpful if we had a 30-second video clip. Any of those kinds of things, we welcome that feedback. So if you have a need and then also have an idea of how that could be solved, please don't hesitate to put that there as well. There was a question about VISN hubs. So for those of you who aren't in VA, VISNs are basically regions of healthcare systems and outpatient clinics. We have a lot of VISN leadership here with us this week. Really excited about that. That is something we do want to start to lean into, is how do we disseminate this knowledge and expertise. So we are going to continue to look forward to getting to know our VISN leadership better and how we can support them at the VISN level. Also, lots of questions about research and simulation. Not that they're the same, research and simulation. Lucky for you, there are presentations and panels about both today. There are members of our SimLearn team who are here demoing in the space, so be sure to stop by, but they also will be presenting today, as well as some of our staff who have created some content on their own related to simulation. And then we'll have Dr. Susan Persky from NIH is going to present about research and how we think about research, what research exists, how we need to think about research and design in the future. And then also have a panel with NIH, FDA, and Stanford to talk through, what are some barriers, what's in the landscape, and how do we need to think about that regulation and research as well. There's also a lot of questions and conversations about peer-to-peer support. How do we leverage this technology to give peers access to peers, veterans access to veterans? There's one you'll hear about a little bit later that is their primary focus. Also had the opportunity and privilege to talk to Dr. Tom Insel last week, who was the leader of NIMH for 13 years. And one of the things he said in some of the research he's done and things that he's seeing is actually some of the younger people prefer to talk to peers even more so than they prioritize talking to specialists. And I would venture to say that is true not just of our younger veterans, but of all of our veterans. So if this is an opportunity for us to leverage this technology to make that more accessible, I know we had a question related to that yesterday, that's something we're really leaning into. So please continue to have those conversations. And that leans into my last comment of, I love seeing all the enthusiasm and excitement. There's lots of generation of hand motions and people running to talk to other people. And that's exactly why this conference exists. It's not just about what we're presenting from the stage, that is certainly important, and hopefully you find that valuable. It's also about the experience in the exhibit hall and the conversations we're having. So many times already, I've heard people say, yeah, but have we thought about this? And could we try that? And what about this? That's exactly why we're here. So please don't hesitate to share those with us as the VA Immersive team, but also continue to have those conversations, because that's how we're going to see healthcare delivery and experience really transform with this technology. Okay, so you'll notice that I've taken a very informal approach when it comes to introducing most people. However, there are at least three that have to be more formally introduced. One of those is Dr. Sharif El-Nahal, who, spoiler alert, he's not here, but he did make a video because he wanted to show his support. So Dr. Sharif El-Nahal is the Undersecretary for Health. He's our big capital B boss at the Department of Veterans Affairs. In his role, he leads in the largest integrated healthcare system in the nation, alongside a team of nearly 400,000 professionals, delivering world-class care to 9 million enrolled veterans. In the first year of his tenure, Dr. El-Nahal has overseen VHA's implementation of the PACT Act, the largest expansion of veteran benefits in a generation. To prepare the enterprise to provide more care and more benefits to more veterans, caregivers, and survivors than ever before, he has spearheaded initiatives to improve access, expand infrastructure, train employees to serve veterans impacted by toxic exposures. Under his direction, VHA also embarked on an aggressive hiring effort, growing its workforce at historic rates, despite recruitment and retention challenges in the broader healthcare market. We're so grateful that Dr. El-Nahal took some time to show his support for this work, and we'll share his video with you now.
Hello and welcome to the VA Immersive Summit. I'm Dr. Sharif El-Nahal, and I have the honor of serving veterans and their families, caregivers, and survivors as the Undersecretary for Health at the Department of Veterans Affairs. While I could not be there in person, I want to thank you for attending this important event. VA Immersive is defining a new reality in healthcare through virtual and augmented reality and reinforcing why veterans and staff choose VA. We recognize that immersive technology like virtual reality and augmented reality have the ability to transform care delivery and experience, and VA is focused on expanding its application and adding to evidence-based implementation. Part of our strategy is getting heads in headsets and recognizing that experience with these technologies brings understanding of the potential impact. Take it from U.S. Army veteran Roger Miller, who is using VR as part of his recovery at the Western North Carolina VA healthcare system.
Yeah, I've never really worked with virtual reality before, so it's new to me. But I'm enjoying all of it. I really am. In your regular physical therapy, working on balance issues, it's enjoyable, but it's work. This is not work. This is like enjoying playing games. If it weren't for the VA, I'd be in a wheelchair. There's no question about that. So, as long as the VA will work with me, I'll work. Hopefully one of these days I'll be able to walk without the aid of any kind of walker or anything. And I'm striving toward that.
Already, we have deployed over 1,200 VR headsets across the enterprise at more than 160 VA medical centers and outpatient clinics to enhance care for veterans like Roger. Leveraging VR and AR, we offer a non-pharmaceutical approach to help veterans address the day-to-day challenges of PTSD, anxiety, depression, acute and chronic pain, and more. One of these veterans is Butch Phillips, who is using VR to help adjust to his new reality following surgery.
When you're in a confined room for long periods of time with a bleak future in front of you and severe lifestyle changes, it helps to get your mind off your troubles, get your mind off your worries, and go to a sandy beach or look at monkeys or look at the stars for as long as you can use it. That way you're not thinking about the pain, you're not thinking about your sorrows, and you can escape and just be free in that environment.
In addition to enhancing care for Butch and veterans across the country, VA is leveraging immersive technology to prevent burnout and improve the training experience for our employees. Employee well-being rooms began incorporating virtual reality in 2020 to reduce burnout with experiences that include mindfulness and relaxation exercises, such as guided imagery, positive distraction, travel, and exploration. VA Immersive also supports employee satisfaction by augmenting clinical education and training. Through our applications, employees can practice real-world skills in the virtual world and build empathy for the veteran experience. For instance, one application allows employees to walk in the shoes of veterans to better understand inpatient discharge from their perspective. From employee training and well-being to direct patient care, we at VA are excited about the potential for immersive technologies to strengthen our system and are committed to continuing to be a leader in this space. I look forward to seeing how this week's summit will impact the future of care for veterans and all Americans. Thank you and best wishes for a fun and productive summit.